If your hips still ache when you walk, sit, or even sleep, even after all the stretching and foam rolling, then this video is for you. Because here's the truth. Most people with hip pain aren't dealing with a flexibility problem. It's usually something deeper, a dysfunction that basic routines completely miss. And if you don't fix it, that tight, burning discomfort will just keep holding you back from your workouts, your daily life, and the things you love doing most. Hey everyone, Dr. Jeff Peng here. I'm a sports medicine doctor and I currently practice in the San Francisco Bay Area. And over the years, I've helped hundreds of patients with hip pain and I've noticed the same patterns over and over again. Most people are either doing the wrong exercises or not doing anything at all. So in this video, I'm going to walk you through 5 targeted exercises that actually treat the root cause of hip pain, not just cover up the symptoms. I'll explain why each one works and how to do them the right way. The first exercise is the glute hip bridge. Lie on your back with your knees bent and feet flat on the floor, about hip width apart. Keep your arms at your sides, palms down. Engage your core and squeeze your glutes as you slowly lift your hips off the ground until your body forms a straight line from your shoulders to your knees. Pause at the top for 2 to 3 seconds, maintaining tension in your glutes, then slowly lower back down to the floor with control. Perform 3 sets of 10 repetitions. If the exercise becomes too easy, you can hold a dumbbell on your hip to add progressive overload. The glute bridge is a foundational exercise because it targets and activates the gluteus maximus muscle. This is the largest and most powerful hip extensor. Many people with hip pain or low back discomfort have underactive or weak glutes, and this leads to compensatory overuse of the hamstrings, the lower back, and as well as the hip flexors. Strengthening the glutes helps restore proper muscle balance around the pelvis and spine, and this leads to improved hip stability and it reduces stress on the lumbar spine and the knees. It also plays a critical role in retraining the body to use the posterior chain effectively during daily movements like walking, climbing stairs, and lifting. The next exercise is the lying hip abduction. Lie on your side with your legs extended straight and stacked on top of each other. Your bottom arm can be bent under your head for support and your top hand can rest on the floor in front of your body for balance. Keep your hips stacked and your core engaged to prevent rolling backwards or forward. Slowly lift your top leg upward to about 30 to 45 degrees, keeping the legs straight and the toes pointed forward. Pause at the top for a second or two, then lower the leg back down with control. Do 3 sets of 10 repetitions on each side. Lying hip abduction targets the gluteus medius, a key stabilizing muscle on the outside of the hip. This muscle plays a crucial role in maintaining pelvic alignment during single leg activities like walking, running, or climbing stairs. Weakness in the gluteus medius is commonly seen in patients with gluteal tendinopathy, greater trochanteric pain syndrome, piriformis syndrome, and lower back pain, and this often leads to faulty mechanics and excessive strain on the hip and lumbar spine. By isolating and strengthening this muscle, lying hip abduction helps improve lateral hip stability, reduces compensatory overuse of other muscles, and restores proper gait and movement patterns. It's a fundamental part of rehab protocols for hip dysfunction and an important preventative exercise to reduce the risk of future injury. Now we move on to clamshells. Lie on your side with your knees bent and stacked and keep your feet together. Your hips should be bent to about 45 degrees and your knees to about 90 degrees. Rest your head on your bottom arm and place your top hand on the floor in front of you for support. Keeping your feet touching and your core engaged, slowly lift your top knee away from the bottom knee, opening up like a clamshell. Don't let your hips roll backward. Keep them stacked throughout the movement. Pause briefly at the top, then lower the knee back down with control. Do 3 sets of 10 repetitions on each side. Clamshells are a targeted way to activate and strengthen the gluteus medius and gluteus minimus, 2 key muscles responsible for stabilizing the pelvis during dynamic movement. These muscles are often weak or underactive in people with hip pain, gluteal tendinopathy, trochanteric bursitis, IT band syndrome, and even low back pain or knee pain. By improving the function of these muscles, clamshells help restore proper hip mechanics, reduce compensatory movements, and offload irritated tendons or joints. They're especially useful early in rehab because they allow for glute activation without putting the hip under load. This makes them safe and effective for patients with pain or limited mobility. The next exercise is the single leg Romanian deadlift. Start by standing tall with your feet hip width apart. Shift your weight onto one leg while keeping a slight bend in that knee. Begin to hinge at the hips, extending the opposite leg straight behind you as your torso lowers towards the floor. Keep your back flat and core engaged throughout the movement. Your hips should remain square to the ground, avoid letting them open up. Lower your torso until you feel a stretch in your hamstring, then engage your glutes and hamstrings to return to the starting position. You can keep your arms at your sides, hold a weight in one or both hands, or reach your hands towards the floor for balance. Perform 3 sets of 10 repetitions on each side. The single leg Romanian deadlift is a powerful posterior chain exercise that targets the gluteus maximus, hamstrings, and core stabilizers while also challenging balance and proprioception. It's especially beneficial for addressing hip and pelvic control, which is essential for managing conditions like gluteal tendinopathy, piriformis syndrome, and even intra-articular problems like labral tears. This movement mimics functional, real-like activities like walking, running, and bending, all of which require hip stability on one leg. From a rehab standpoint, the single leg RDL trains eccentric control of the hip and hamstrings, helping to reduce strain on painful structures, correct imbalances, and improve load transfer through the hip and pelvis. It also improves neuromuscular coordination and reduces asymmetries that often contribute to chronic overuse injuries. The last exercise is the step up. To perform a step up, stand facing a sturdy step, a box, or a platform. Hold a dumbbell in each hand at your sides with your arms relaxed. Place one foot firmly on the step, keeping your entire foot flat. Engage your core, press through your heel, and drive yourself up until your leading leg is fully extended and your trailing leg meets the top. Slowly lower back down with control, returning your trailing foot to the ground. Keep your movements steady and avoid pushing off with the back leg. Do 3 sets of 10 repetitions on each side. Step-ups are an excellent closed chain functional strength exercise that targets the quadriceps, gluteus maximus, hamstrings, and hip stabilizers, all muscles critical for climbing stairs, walking uphill, and rising from a seated position. Holding dumbbells adds external resistance, which increases the demand on the muscles and allows for progressive overload. By gradually increasing the weight, the height of the step, or volume over time, step-ups can build strength and endurance while also reinforcing proper lower limb alignment and control. This is especially beneficial for patients recovering from hip or knee injuries, managing arthritis, or dealing with gluteal or piriformis related dysfunction. This is important because building strength and stability in the hip as well as the thigh muscles can significantly reduce pain and improve functional performance. These strengthening exercises are key to building the support and stability your hips need, whether you're walking, climbing stairs, or just trying to stay active without pain. But for some people, tightness and stiffness are also part of the problem. That's why you want to check out this next video where I guide you through a simple 5-minute hip stretching routine. It's designed to improve mobility, loosen up stiff muscles, and help your hips move the way they're supposed to so you can feel even better faster.